Hello everyone, I'm Samson Yepi. I'm making this video regarding the 8 hours of volunteer time spent in the Army Public Health Nursing Department of Carl Donald Army Medical Center located in Fort Hood, Texas. So, talking about the medical center, it's a variety of a clinic and three community-based medical home that can support 42,000 active duty personnel and more than 145,000 family members. The staff at Donald Medical Center deliver 80 new babies, handle 4,258 outpatient visits, 19 surgery, 28 admissions, 226 emergency room, and fill 4,160 prescription. Before we go in depth in what I really do during the volunteer time, let's talk about the STR in the United States military. The type of STR that we frequently see in the United States military are chlamydia, gonorrhea, syphilis, and the number is shown as follow. In 2010 and 2018, we have 350,000 troopers that was diagnosed before sexual transmissive disease. According to the reports, we have 212,405 cases of chlamydia, 32,987 cases of gonorrhea, 4,674 cases of syphilis, 28,295 cases of genital herpes, and 71,138 cases of HPV-3. So female is the population the most affected in the military population in general. So what did I really do? So during my internship or during my 8 hours of volunteer time, I have a chance to work with Captain Spencer, and with Captain Spencer we conduct together a epidemic surveillance through a ADRSI. That is a software that I may use to conduct a epidemic surveillance. So the task was consistent create a spot report for the current date and identify the new positive of chlamydia and gonorrhea. Those two STR are the most STR diagnosed in the Army population, especially in Fort Hood. And once we really identify the new positive, we compare this list and the new positive to the list of the previous day to see if it's the same patient that show up in the new roster. So once this process is done, the next step consists of enter the information of the patient in the ADRSI if the patient is not already registered in the system, and then create what we call the medical event reports of a patient. This medical event reports is created in the system ADRSI, and where we have to give over more information about the STR the type of STR the patient is facing, the date it was diagnosed, and if the patient is treated or not treated, we have to provide this information. All this information is included in a form that we call the MIE for the states. And this report is a report that is edit in PDF and faxed to the states. This report is given to the state in order to help the state do what we call the global epidemic surveillance. Once this process is done, we send an email to the service member of a soldier primary care provider in order to request the treatment of the soldier if the soldier is not already on treatment. Now, question is to know what the lesson that I learned during this 8 hours of volunteer time. So I have learned the importance of conducting the epidemic surveillance and how this epidemic surveillance is conducted in the military. I have learned how the military collaborate with the states to conduct a global epidemic surveillance, even though most of the information regarding the soldier health is not, diffusible. You can release those information is, and those information are classified. And the other thing that I have the opportunity to learn is learn how the Army Public Health Nursing conduct a public health promotion, which is my concentration in this degree accomplishment program. And so, in conclusion, to conclude this little small experience that I spent with them, there's so many stuff to learn, but the time was so short. So, I didn't really have a chance to touch so many stuff that the department, does. But in conclusion, I can refer to the book of Luke, chapter 14, verse 31, and in the light of this verse, we understand that the prevention of the disease among our troops increase the welfare, but also the combat readiness of any military mission. So I hope this video was so helpful and help you understand what I really do and I really did in this clinic, and I open up to any question that you might maybe have. You can email me and I will give more detail. Thank you, and may God bless you and bless your family.